इसमें अलग क्या है?
कोल्ड स्टोरेज डिलीवरी, इंसुलिन फॉर डायबिटीज एंड अदर मेडिसिन भी।
लेकिन इससे होगा क्या?
मैम मेडिसिन फुल्ली इफेक्टिव रहेंगे।
पक्का?
सर अपोलो 24/7 से हैं।
एक्चुअली इनको डायबिटीज है। नीडेड टू बी श्योर।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं कोल्ड स्टोरेज मेडिसिन सिर्फ 4 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
रिपोर्ट सारी तैयार है?
हाँ सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
Very good morning, Apollo family. I understand how a simple headache can ruin our day. Imagine people suffering from chronic headaches. It must be impacting their quality of life and productivity as well. How do we understand and manage our headaches? Which kind of headache requires immediate medical intervention? Can these headaches be life-threatening? How do we manage chronic headaches? Join us in today's live session of Apollo 24/7's Health Hour, where we have Apollo's health expert, Senior Consultant Internal Medicine, Dr Ashish Chauhan, who is going to answer all your questions related to headache in the live session. Join us today at 11 a.m.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar, good morning and welcome to Apollo 24/7's Health Hour. Health Hour is a show which brings you Apollo's experts every week to this live show where you can ask your questions and queries and we will get an answer from the expert. Today we're going to talk about frequent headaches and what could be the causes and how do you address these headaches. Joining us very shortly in this live session is Dr. Ashish Chauhan, who is a general physician and senior consultant internal medicine from Apollo Hospital, Jubilee Hills, Hyderabad. And you can type your questions on the YouTube chat wherever you're watching this from. We request you to type your questions if you want your query to be answered only on the YouTube chat so that we can ask your question in this live session. All right, before we start, Let me also remind you that please download Apollo 24/7 app, because it's not just bringing entire Apollo services to your palm, but it is also going to give you an opportunity to participate in our health quiz today and win vouchers from Apollo 24/7. So keep waiting. There are discount vouchers and gift coupons to be given away. Also participate in the health quiz towards the end of the show. Let me begin the show by introducing you to an initiative which is a wonderful initiative by Apollo 24/7 and Apollo Foundation. This is Saving a Child's Health Initiative, free pediatric consults for every child in need. Sachi, in association with Apollo 24/7, is on a mission to make quality healthcare accessible to underprivileged children at no cost. So, more than 10 plus pediatric specialties who are renowned Apollo pediatricians are benefiting children across India. There's a QR code on the screen. You can scan this and know more about the initiative. Well, let's start today's show. Let's talk about frequent headaches and what could be the causes. Joining us now is Dr. Ashish Chauhan, General Physician, Senior Consultant in Internal Medicine from Apollo Hospitals, Jubilee Hills, Hyderabad. His professional memberships are ranging from Indian Medical Association, Thyroid Society of India, Christian Medical College, Christian Medical Association of India, Research Society for the Study of Diabetes in India, and his specializations are diabetes and adult immunization. A lot of awards and achievements are bestowed on him. Indywood Medical Excellence Award in 2016, Vaidya Shri Award, Vaidya Shiromani Award, Certification of Excellence from Lions Club International 2021-22, and also Dr. APJ Abdul Kalam Health and Medical Excellence Awards in 2021. He is also penned the chapter of Insulin Infection Immunization Insurance in Ultimate Guide to Insulin, which is published in the UK. Dr. Ashish Chauhan, good morning and welcome to the show. Well, we are unable to hear you. If you can please unmute yourself.
Doctors are not very tech savvy, so sorry for that. Thanks a lot for that wonderful welcome and introduction. A big welcome to all the viewers of this program. I'll be very happy to help you out with your doubts related to frequent headaches. Yes.
Wonderful, doctor. So, sir dard sabko hota hai. एक या a day or two might be without headaches, but we commonly say अरे यार ये सर दर्द है. So this has become a part and parcel of life. So I don't think there'll be ever a human who's passed away without having a headache for even a few seconds. So what is a headache that should have an attention to, and when is it that I should understand that is a headache which requires medical attention?
Before I address that, all my beloved viewers, I'll just correct Jhansi ma'am that my specialization is diabetes and adult immunization for all purposes to say anywhere else. But my honest specialization is keeping people out of hospital. So if you have a headache,
Wonderful.
or if you have somebody around you who has got a headache, then we'll have this discussion going on. Headache sabko hota hai? Yes. 96% of the people in the world have headaches, and 4%. It's always nice to have the right kind of information. There's so much of infodemic
True.
right now around. Apparently 4% of the people, and I would want to really find them out and give them the Bharat Ratna, ki how they do not have the headache at all. But this is what on the record. So 96% includes me, you, and everybody who is on this platform. And having headache is absolutely as normal as possible. The only thing is we need to understand how frequent are these headaches and what is the nature of these headaches, and do you and me or somebody thinks that we should require a professional help, then we better take it before it's too late, because yes, headaches can be fatal. So that is what I think today's discussion will be all about, to find out
Right.
this thing, when it is fatal and when we can address it earlier so that we can have a good outcome.
Perfect. So, what can be the common causes or triggers of headaches? How do we understand that yes, this is a frequent recurring headache? People might have triggers.
The common causes of headaches is having political debates or having a bad partner.
ठीक है, doctor. I understand
think-
stress is a major factor.
Yes,
And we should
yes.
have Dr. Ashish
We
Chauhan's
should.
session to keep you stress free.
Yes. My dear friends, beloved viewers, keep laughing. Whatever be the reason for the headache, you laugh, and the right kind of company will make sure that you do not end up in any kind of big tragedy or a fatal nature of anything. Who all
Ji.
can get headache? Anybody. you know Please
Okay.
do not discriminate. Yeah, yeah, with irrespective of age, caste, creed, gender. Rather, there are few headaches which are more in particular gender, like we have a cluster headache which is more in men. So these are the different kind of headaches we would want to talk about it. The commonest being migraine, tension type headache, cluster headache, and these are the what we call it as a primary headache. So easy way for
Okay.
general people to understand, there is a primary headache and there is a something called a secondary headache. Secondary headache has a secondary reason behind it which we need to address it, and primary headache
Okay.
has a primary cause for it, a vascular cause, and common reasons like migraine, tension type headache, or cluster headache. These all turns out to be the primary headaches. So if you understand that your headache is actually becoming a headache, your work is affected, your relationship is affected, and you know what? Very simple. Three people, your boss, your BV, and your bache, three people are affected. You need a professional help. So definitely reach out to a professional help before it is too late. That's a dictum. That's what I would want all of my viewers to understand.
Great. So, you were also talking about fatal headaches or life threatening headaches. So, understanding that the stress factors and other factors can be one major thing. What do these fatal headaches look like, and how do they have any onset or symptoms or triggers?
See, fatal headaches are the headaches where patients delay in reaching to doctor. You know, heart attack, paralysis, or all the fatal events, they occur suddenly, but they come very slowly. Now please
Okay.
understand, one time a headache killing somebody is very very rare. It's like we've been having it from last few months or few years, and we kind of did not take it seriously. It was every time paracetamol le lo theek ho gaya hai, and then we ourselves starts googling it, and that's where we end up into problem. I am not
Correct.
uncomfortable. Say, any problem with vascular thing in the brain can be fatal. An aneurysm which can blast or which can open up. Aneurysm is in pure Hindi, वो गुच्छा होता है. It's kind of multiple blood supply which is kind of made bangles kind of thing, or round worms kind of figure in the brain, and which suddenly bursts open up. So what happens is it will always have a headache which will be there from couple of months, couple of years, and because of our nature of neglecting it, we have not taken it seriously. Whenever somebody suggested neuroimaging, we said is, अरे यार इसमें तो डॉक्टर का कुछ कट इन्वॉल्व होगा. अवसरम्मा. See, in Telugu word I always say two Telugu words for people who are probably from Andhra Telangana which kill people here is number one word is avsaramma. Zarurat hai kya? Anytime a doctor writes an investigation, if you have a headache, doctor thinks you should do a neuroimaging, for heaven's sake, do it. This question of avsarama zarurat hai kya, that is the reason for the fatal events which we get it. So if what are the red flags? The red flag you can have a disaster is whenever you're ignoring your doctor, whenever you're ignoring somebody who loves you the most. If your wife tells you, if your father tells you, if your brother tells you, do it. Make sure that you are well physically, objectively. See, there are two assessments. One is subjective assessment, which you and me can do it,
G.
and second assessment is objective assessment. We found that your blood pressure is consistently high. We found that you got a eye problem. Probably there is some blurring of vision which is there. Probably there is something where there is a neurological deficit. वो एक सेकंड के लिए आपके आंखों के आगे अंधेरा आ गया. So if you have any of these things, please don't take it lightly. Say, we call these
Right.
events are transient ischemic attack, TIA. वो एक बार हुआ,
Okay.
and then you became normal. So just because you became normal, that means Thank God, God is giving you chance to reach out for the professional help, to reach out for the investigations which you are needed, and take the
Right.
medicines as per the advice of the professionals. By any
Right.
chance you have reached out for a professional advice and you believe that this doctor is a commercial, because a lot of people nowadays label people as commercial doctors, non-commercial. If you have that feel, move out to another doctor, but do not stay back at home ki bhai maine tablet le li hai, everything will be fine. That casual attitude is the number one cause of the fatal headaches, is what I would want to tell everybody.
Yes. Doctor, while you have answered this question, I think Rajdeep Dhar, आपका question answer हो चुका है कि कौन से fatal हो सकते हैं, life threatening headaches क्या होते हैं. That was his question. Kanav Chavan ji, we are going to take up questions. Do not worry, we are going to come to audience's questions. Just before we start off and other audience are joining us with their questions, let me also ask you कि थोड़े लोगों को सामने सर दर्द होता है, थोड़े पीछे होता है, थोड़े सेंट्रल होते हैं, थोड़ा all around eyes and behind the ears होता है. So does the type of the headache and the location of the headache have any indications of possible causes or seriousness?
Now you have asked me a tough question and a scary question. See, what has actually killed most of the people is the Google doctors. So though you have asked me and I
Okay.
will answer it, but I would want people, these all are the typical presentations. If you have a hemicrania, half of the head is having a pain, it is high possibility that it is a migraine. Okay, a very, very common
Right.
nature. And migraine does not require a what you call neuroimaging, but that is not
Okay.
100% truth. Please don't quote me and get mismanaged. Let your clinical clinician who is treating you be the right person to decide it for you. So if you have half of the head which is paining, if you have a photophobia or phonophobia, photophobia का मतलब होता है like if you are suddenly you have a headache, you don't want to talk to anybody, you want to sit in one corner in the room. This is what is classical migraine is all about. You don't have any kind of exposure, that is photophobia. Phonophobia is you don't want to hear any sound, you don't want to talk to anybody, you want to isolate yourself. So then that is very, very classical migraine. It can have a aura, it can with or without aura. Aura is like it is about to come. It's a periodic in nature. It comes every 1 month or 2 months. Usually starts in the teenage to the young age, and it comes for over few years. And majority of the headaches are migraine or tension. It is a big debate. A lot of people want to say majority of the headaches are migraine, and few people say it's because of stress related headache, because we all have stress. See, what happens is whenever migraine is inappropriately ventured into, then everybody labels it as a stress related headache. So it's a kind of overlap zone. But yes, if you have half of the face which is involved, especially the head, then probably the chances are that you have a migraine. And it can be, if it is only in the eye region, okay, and if you're a male, then probably and associated with the eye secretions, nasal secretions, then it is a cluster headache. In those kind of things,
Okay.
this class of drugs
And how?
like as will help you out. Yeah.
Sorry, doctor. Sorry to interrupt you here. Did you just say that you have pain in the eye and if you're a male? So does that mean anything specific with gender? Female do not get these cluster headaches?
Female gets it lesser than the male. Say males
Acha.
in a cluster headache is more with the men. Very rarely, actually majority of the times ladies get the headache. So if we say migraine, if we say a tension type headache, I always salute the womanhood, because majority of responsibilities which men want to shrug it, it actually comes to the woman of the house, and she ends up having a lot of stress, and then there is a reason for it. So stress headaches are primarily more in women, stress and migraine,
Gee.
and the cluster headaches are more in men. This is what is a rough things to say it out. Definitely clusters are more in males, but these things are not the, there is, you do not use the word never. Cluster headache can never come in the women, that's not there. that a migraine cannot come to men, or all those things. These never statements in medical science. We do not use the word never. There are always rare
Uh,
possibilities. There is an autoimmune disease, SLE, which comes only in the young
yes.
ladies between 15 to 25, 30. And I have diagnosed in a 70 years old male, which almost 15 of my colleagues said no, ki, it's not possible. But we diagnosed it and patient improved with the treatment. So in medical science, there are no absolutes. In medical science, it's
Right.
all
So
about
while we're talking
possibility.
about cluster headaches, sorry to interrupt you, Doctor. Ganpati Subramanian Shanmugan is asking this. Are there any recent advancements in cluster headache management?
That's a very good question. Advances are happening every day. Okay, there are 1 hour of time, and we have 2,500 papers which get published, and that's why it's always good to use Google and talk to your doctor about it. But you need to be careful, my dear friends. Four things: Google, technology, science, and money. I'll repeat it always. Google, technology, science, and money, they are the good servant but bad masters. So do not try to confront your doctor with the recent advances, which probably he is not aware of it. Even if he is aware of it, he knows the side effect of that technology, which is not mentioned in the Google. Say there are a lot of things which are hidden. Say the side effects. Ki probably few drugs which are working in the Western population do not work in India. There are a lot of things in between the lines which are not there in the web. So let your doctor decide it, though obviously asking your doctor a chance, that usually helps out. In cluster headache, sumatriptan, these are the triptan kind of drugs which work out. And there are lots of new things are coming right now. Probably that's a tagline for our presentation today. For the migraine, new thing which has come up is what you call Botox therapy, and which is helping out. So every day we have something new coming up. That's why seeing your doctor regularly, and
Hmm.
whenever you're reaching a doctor, please write your questions and ask those questions. Say, don't get
Right.
mesmerized by the billboards which you see here and there. When you ask these questions, doctor can give you a better answer. You must understand, it's always easy to say that doctors are gods, but they are not. You must give them time also. There must be some therapy which has got released 1 month back in United States, and you're asking the same question to a doctor: can we use it, can we not use it? So I think what you need to have it is, these all things are over the years, and you should let your doctor give his personal advice. And last point,
Yeah.
always let him be the deciding. Talk it out and let him to take the final call. And last word, which you can always help out yourself: sir, if you were in my place, what choice will you go for? That helps
Yes.
out. A headache can be
Wonderful.
treated with 5 rupees. This I would want to close with this. A headache can be treated with 5 rupees, 50 rupees, 5,000, and even 50,000 rupees also. So these things you need to just have a discussion and let the doctor take the best call for you. I hope that clarifies. There
Great.
are a lot of new things coming up in cluster headaches. We'll talk off the record whenever we have a time.
Sure, Doctor. Doctor, I have another 35 minutes to go for this live show, for the question answer session. And I have a lot of questions, nearly 200 questions people are waiting with. So, next question I would want to ask is, I would want you to condense. I know that you're an eloquent speaker, but I would want you to condense and give slightly shorter answers so that we can address more queries. I used to, Anmol Kesharwani, I used to get headache every 3 or 4 days, cold every month. So, and a lot of people are also asking about this cold and headache. So, is it seasonal, or how are they related to?
Cold and headache at this time, high possibility to be sinusitis, number one. Could be because of COVID, subclinical COVID presence with headache and cold. So it can be sinusitis, it can be COVID, it can be any other infection. You need to reach out to your physician to have the right kind of answer. When in doubt, neuroimaging is always helpful, crisp and clear.
Done. Wonderful, Doctor. Subhajit Bhattacharya, male. I have frequent headaches from the age of 14, and I have issues with my eyes, memory, and mood swings. I face serious problems in my life due to this. Please help.
Okay. My question clear cut will be: have you done a neuroimaging? Number one. Have you seen a doctor on a regular basis? Number two. The way you're telling me it started from 14 years of age, it could be a migraine, it could be a cluster. If it is only around the eye and it is associated with some kind of nasal discharge and eye discharge, high possibility it is cluster. Otherwise, if it is hemicrania, it is because of migraine. Last but not the least, you and me are Indians. We always can have a tuberculosis in the brain, infection in the brain. Neuroimaging is very much needed. Ask your doctor to help you out with and go ahead and do it.
Okay, that is a serious advice. So we need to do not underestimate your headaches. Next question is Ahmad Shari Jamal, 28-year-old male. I get severe headaches sometimes and usually get better after vomiting. I have been getting such headaches for the last 5 years. Frequency is 3 to 4 times a month. And related काफ़ी सारे शरीक जमाल जी के क्वेश्चन के रिलेटेड भी काफ़ी क्वेश्चंस हैं कि हेडेक होता है देन वॉमिटिंग के साथ बेटर होता है वन साइड हेडेक होता है can't manage my regular things. So what is your
His,
understanding of
his
this?
classical his classical migraine. Migraine headache is half-sided headache. It is associated with vomiting, and then it is episodic, like 3 to 4 times in a month or once in 2 3 months. It's kind of on regular basis it comes, and usually you have an aura. So that's one part of it. I've already shared, and I've still speak it out. Do not miss out tuberculoma. I hope I'm not scaring you. Can we have something in the brain like a brain tumor? The answer is yes. A classical brain tumor is not recurrent. It's usually headache with vomiting, and vomiting relieves the headache is because of brain tumor, or what we call the word as SOL, space occupying lesion. Space occupying lesion will have a headache which is relieved by vomiting. Just reaching out to your doctor, discussing it out, and doing one neuroimaging CT scan or MRI. Usually, MRI is superior. You must do that.
Done. So how about these headaches? Managing migraine के बारे में Bidisha Dash is asking. Also, somebody else also was asking. Bidisha's question is: I have migraine and it is so bad that I need to take injections to get over it. And Rahul Kahane is saying, I'm suffering through migraine. Best diet and what should be avoided. And can migraine be once for all treated?
Very good, very good question. What is the treatment for migraine? Now, these are is a huge list of how do you handle it out. Simple paracetamol quite often helps. Paracetamol with anti-emetic agents, that is anti-vomiting agents like domperidone helps. This is for few subset of patients. For few patients, we move to the next level where we use something called as triptans or Sibelium. These are the medicines. They have to be taken for a period which is specified by your doctor. Next level probably will be sodium valproate or giving few other medicines. So these all things are there which you need to talk to your clinician about it, with a physician, with a neurologist. Finally, there is something called as refractory headaches. Now, refractory migraine, you have taken all kind of treatment. You would require something big, and it is affecting your lifestyle. It's affecting your working pattern. Botox usually helps in these kinds of cases, which we need to understand, and that's what I was talking to you about it. Please reach out to us or to neurologists. My very great friend Dr. Sudhir Kumar is from Apollo Jubilee Hills. He does the work. You must meet to a right kind of center and get the right kind of therapy, and then talk about it, and you can take Botox injection, which helps. And then we have another therapy which is very latest, antibodies, monoclonal antibodies which are used, and that can be given once in a month injection for 6 months. This costs around 20,000, and it will change here and there. These may sometimes may sound costly options, but the ones who are getting it, they themselves know it. Ki Baba, it's not, it sounds tough, but once we got it, we realize it. If we have taken, if we have been benefited it, it's much more reasonable. I hope that should end the things, and anything else I'll take up in the next
Right.
question.
Any foods that can trigger, because I was just trying to figure out a question which says एसिडिटी के साथ होता है क्या? Yes, Akhilesh Kumar is asking, my wife has frequent headaches, especially on days of fasting when she's not having salt. And also, I missed the question where somebody was asking about acidity and headache. So, are food or fasting related to headache, doctor?
Quite often, yes. Now, there are a few things which you need to understand. It is these all are individual triggers. Who is the best doctor? Old patient is the best doctor. A patient himself will know whenever I eat this, I get the headache. Say coffee. I cannot survive without it. My breakfast is coffee, and while I'll do these kind of talks, I take coffee. But coffee itself is a trigger factor for a migraine for a lot of patients.
Really?
Chocolates, yes, yes, yes. Chocolates are the trigger factor for the patients. uh, um, Sleeplessness is one of the very strong reason for the headache or even for seizures, because when we talk about headache and seizures, all the neuro thing they go together. If you are not having a proper sleep, you can have a kind of migraine, and you need to understand. And when we talk about sleep, oversleeping can be troublesome, undersleeping can be troublesome. So remember, my dear friends, divide your time properly. 8 hours of your work hours, 8 hours of your sleep, 8 hours of your social life. I think what is happening off late, when because of the COVID or pandemic and home way of working, homework sessions, we are overworking. 8 hours are becoming 10 and 12. And most of the IT firms, now I know all the IT firms are not going to like it. They are kind of exploiting key anytime they will log on to the work and say, now we are talking for 1 hour on this. Too much of strain and having an eyesight and refractory errors can be the reason for headache. So headache is not because of one reasons. It's always has got a triggering thing, and you may need to balance it out individual basis. Not everybody has got a same treatment for all the headaches. That we need to understand, and professional help usually helps out in sorting it out what needs to be addressed.
Done. So while you're talking about the sleep, I think Sajid Srinivasan, you must have got your answer about can the headaches arising from lack of sleep be recovered by sleeping enough?
Yeah, see what happens is, please don't you misuse the word enough. Somebody will say, sir, I usually get headache because I sleep less than 10 hours, and then you will have a work hour issues. So 6 to 8 hours is the ideal time to sleep. I will say keep a borderline of around 7. More than that usually will be a problem, less than that will be a problem. And it is directly even related to your mood. It's related to your blood pressure and blood sugar. High blood pressure can cause a headache. High blood pressure will finally lead to brain hemorrhage, which will cause a headache. That is what will end up having the fatal sign. So make sure that you learn how to have optimization of your lifestyle. अति का भला ना बरसना, अति की भली ना धूप, अति का भला ना बोलना, अति की भली ना चुप. I think that will be the tagline for all of us to remember.
Fantastic, doctor. Well, next is Sandhya Suresh's question. Sir, I get headaches after visiting functions where there are bright lights, and also get headaches if I go outdoors due to in the afternoon times. Yeah. So,
Yeah,
what
so
kind of
that is
headaches are these?
usually, yeah, that sounds like a migraine one, and that is what is classical triggering factor for her is it may have an aura that where you get a flashlights and all those things, or tomorrow I'll get a headache. These are the kind of aura things are there. Taking a professional advice and a regular backup is important. Pregnant women can get headache when their blood pressure is high or if they are having eclampsia or pre-eclampsia. Now, these are something which are scary even for the child also. It can compromise blood supply to the child. So, blood pressure monitoring is very much important. Going for the right kind of professional advice is very much important. Um, More advice is good, but don't get carried away. Too much of googling scares it. I'm not too against Google. I enjoy and use Google a lot, but you need to balance it out. And talking to one doctor, that is your family physician, your Dr. Chacha, Dr. Mama, you've been going from last 10 to 20 years, will be more appropriate for you to reach to the right diagnosis.
Done. Here's Dinesh Chawla's question. What's the cause for one-sided headache, mostly on the left side of the head?
Migraine, number one. Stress, number two. The third is the right answer. Stress plus migraine together.
Okay. So while we're talking about stress, Dharam Singh ji bolte hai, my wife says that she is having headache always. She faces small tension, and even if she faces a small tension, she says that she is having headache. So ये tension headache क्या होता है, and how does one get relief from it?
Ah, all married people get it.
ठीक है. Do you think that children don't get it? Tension के साथ.
Oh, no, no. Thanks for bringing that point out. Nowadays, even children have a lot of headaches, so we all get it. Tension headache is a headache which people get it who are spiritually immature. Say, I would quote a word of Swami Vivekananda. If you have
जी.
spent a whole day, and in whole day there has never been any problem in life, मतलब कोई भी परेशानी नहीं हुई है, then be assured that you're on the wrong track. If you're a right kind of person, you will have a problem in life, and you need to address it smilingly. Okay, so tension कुछ नहीं होता मैम. Tension is a
जी.
situation where you do not know how to tackle it. Everybody has got a same environmental exposure. It's just that we are overreacting to situation. That is what is tension, and we all need to learn our own ways to handle it. Can it kill? It does. All the suicides are tension, headaches, or stress which was mismanaged, which was not managed by the by your friends. What is the best answer to your tension? Your friends. You need to spend time with your friends, be it your own spouse, make her or him as your a friend. Um, a quote which is written in the cardiothoracic, open heart surgery karte hain, cardiothoracic doctor who changes the blood vessels and all. He has written it in his operation theater outside. It's a pure Hindi quote कि जो दिल खोल लेते यारों के साथ, जो दिल खोल लेते यारों के साथ, न खोलना पड़ता औजारों के साथ. So I think the same thing goes. High blood pressure and high hypertension causing your brain to have a brain hemorrhage. All these things are because you're not managing your stress levels well. Work life pressure, we all have it. Jhansi has it, I have it, even Prime Minister has it, President has it. So we need to address it appropriately. Stick to your friends and keep smiling, keep laughing. That's what we all need to understand. And whenever things are going out of the hands, reach out for your professional help. You require a physician, you
Yes.
require a neurologist, you require a psychiatrist, go for it.
Done. Dr. Digestion and headache के बारे में काफी सारे जोएल पूछ रहे हैं, and lot of people are asking about digestion and headache. Is it connected?
Very much. Say, what you are is depending on what you eat. Number one. Number two is what you are is what you have avoided to eat. So this is what we need to understand it. And diet and headache and diet and lifestyle is very, very common because of this homework phenomenon post COVID and COVID pandemic has made people to be alive like the way we are and keep grabbing and eating consistently. Now, a depressed patient, a stressed person ends up either eating too much, which happens in the 80 to 90% of times, or 10% of time they will not eat at all. But the less eating is very, very less. People tend to eat a lot, and that actually connects directly with your headache also. What is direct connection? You will have to find out by yourself. There are few people, as I've
जी.
already told you, coffee and chocolate will cause it.
Chocolate.
You find it out that it is causing a headache to you. Avoid it. Best answer. You are the best doctor. And finally, sometimes you can do this googling and see. For diet, you can afford to do googling. There are rare causes of diet which are causing the migraine to worsen or stress to worsen. Go for it. Not an issue. Anytime, feel free to ask us. We'll be very much there to help you out in 247 or even on the physical meets at Apollo hospitals.
Yes. And it's quite easy now to consult on Apollo 247, and Dr. साहब का link भी हमने यहाँ पर छोड़ा है. If somebody wants to consult Dr. Ashish Chauhan, he can be consulted on Apollo 24/7 as well. Well, Doctor, here's Aman Tiwari's question. What is the best prophylaxis with migraine and mild tinnitus. तो tinnitus कान में जो
माइग्रेन
आवाज
विद
सुनाई देता है.
हाँ जी, कान में आवाज सुनाई देती है. आई बिलीव you need to reach out to your neurologist or ENT surgeon or a physician. See, there are different things. Now, migraine can be triggered by a tinnitus, or a classical migraine can have a tinnitus, but you don't want to miss out even uh, a disease like that of Meniere's disease, which is endophthalmicus. There is increased pressure in the ears. So something with ear is directly connected to you for your work output. You can't afford to have output which is doubtful, because it may probably will end up reaching out a deafness as well as hearing loss. So if you have a tinnitus is something which I'll always say, please reach out to the ENT and sort it out. If this is requires something aggressive management, we should not miss it out. Once ENT person has ruled out, feel free to reach out to your physician and neurologist to help you out. But managing it by yourself, not a great idea. So
Great. Yes, doctor. Here's next question from Unique Videos. उनका नाम नहीं दिया है उन्होंने, age and gender भी नहीं दिया है. I've undergone several tests which include MRI of brain, but nothing to be found abnormal. But still, I'm suffering from headache and migraine.
yes, so probably you are answered yourself. You have a refractory migraine or a headache. Reach out to one center probably and request them to help you out with probably Botox or even Irinumab. That's what I told. The antibody monoclonal antibodies are there, which can be taken injection, subcut injection, 6 injections over 6 months. Probably this will help you out. I'm fine, very fine to say. Dr. Sudhir, my friend, is available at Apollo Jubilee Hills. 247 usually helps, so that even you can reach out to me. Now, one thing before I go. So you can meet a doctor in 4 places. My dear friends, you can meet doctor in 4 places. Number one, physical, face to face. Number two, online. And number three is ICU. Number four is in emergency room. Now, the time you miss out the first two things, face to face or online, you will end up meeting them in the ICU or in ER. So more and more, I told
Okay.
you, my specialization is keeping you out of hospitals. We can only keep you out of hospitals if you reach out to us much before it is too late. I hope that makes sense to you.
Yes, I'm looking out for a question which was asked by a husband whose wife is pregnant. I'm not able to give you the name. He says that wife is pregnant and she has headache. So pregnancy and headache, how important headache becomes here, and evaluation becomes important here.
Okay, there is a headache which comes only during the pregnancy called as preeclampsia, and then preeclampsia becomes eclampsia. Now, eclampsia is a dire emergency. You have to reach out faster and probably terminate the pregnancy. Reach out for a professional help. Reach out to a gynecologist or an obstetrician, or reach out to an internal medicine specialist, and we need to see that. There is another possibility is patient had a headache and became pregnant. In that time, most of the medicines we need to stop. Like a usual medicine which we give for blood pressure is ACE inhibitors or ARBs. People will know it as captopril or Telma. Now those medicines we cannot give to a pregnant woman. So let your doctor decide it. It can be alpha methyl dopa or nifedipine. Let these medicines help, and the professional help is already needed. When it is a pregnant woman, do not use your brain. Please reach out to a professional help, because we need to play around with the medicines. In pregnancy, our options become very, very limited. One person whom I do not give any medicine or give the least medicine is a pregnant woman, because anything which you give will and may possibly affect the baby, and none of us want a child who have a defect because of the treatment which you are given to mother.
Yes. Here's Mr. John Dumu's question. What is the plan of treatment, and how long do we have to use these medications to prevent migraine attacks? And will these also have some side effects if used in the long run?
जिंदगी में कोई भी चीज जिसके इफेक्ट होंगे उसके साइड इफेक्ट होंगे, मिस्टर जॉन. Anybody who reaches out and said this medicine has a side effect, there is no medicine which does not have a side effect. Okay, please get this thing very, very clear cut. And any other alternative medicine who says there are no side effects, वो आपसे bluff कर रहा है. So it's very simple. It's just that they do not know what are the side effects of this tablet. Okay. In allopathy, we have done so much of research that we ourselves will tell you side effect of everything, and it is easily available in Google. And that's why the too much of knowledge kind of confuses the people. Let your professional doctor decide it for you. Okay. How long do we need to give treatment for migraine? Lifetime? Probably no. If you're kind of having it lifetime, that means you've not reached out to the right kind of doctor. Diabetes, hypertension, thyroid, HIV, or autoimmune disease. These are the few diseases, 5 diseases: diabetes, hypertension, thyroid, autoimmune disease, and HIV, which at this time requires treatment for the lifetime. Other than that, no. Migraine can be sorted out. Asthma can be sorted out. Take the right kind of treatment. What usually happens is people take the treatment without telling the doctor stop it, and then there is a rebound phenomenon. So if you're reaching to the right doctor at the right time for the right time of period, you will get the right kind of treatment.
Great. So, next question is from Kavya. Kavya is worried about her migraine. She says, does migraine cause swelling in the middle of the brain? Should I go for a neuro or scan? Also, while you were talking about neuroimaging and people's apprehension, there's a gentleman who has been suffering with headache and migraine and a lot of other headaches which are repeated, but a lot of people are stopping him from getting a neuroimaging done. So, what would you suggest here?
Always to do it whenever there is a doubt. Say what we need to understand it is technology is there to help you out. Okay, and always go for the best one. Don't go for the slightly there it is too costly, here we are getting at half of the rate. MRI is of different Tesla. There is something called as 1.5 Tesla and 3 Tesla. Say if you are getting, please understand, because a lot of people like to compare MRI in this institution is this much, outside we're getting at half of the rate, there we're getting at quarter of the rate. Okay, I'm not trying to justify Apollo or any corporate hospital, I'm just trying to educate you. Please get things clear cut. When we look out for a four-wheeler, a nano car is a four-wheeler, an Innova is a four-wheeler, a BMW is also four-wheeler. All three are the four-wheelers and cost are different. Like that, MRI simple is again 2-3 different types of MRI, different with respect to its imaging possibilities and 3 or 4 dimensional picture which it can produce. We usually advise people to have it once in the 5 years. Aapko, if you have a gut feeling, can it be a brain tumor? Now there is no doctor who can write it 100% you cannot have a brain tumor. Can I have it? Can my anchor Jhansi have it? All of us can have it. So, can we have a tuberculoma? Oh, definitely. We are in Indians. That's where the type of secondary headache comes. Don't go by the figures so much where you say 90% you won't have it, 10% you can have it. No. So, doing it once will help you out to stay away for 5 years. You are comfortable that you don't need to repeat it. So, abhi 2-3 months or 2-3 years you're doubtful about it, do it. Clarify so your doubt is over. Otherwise, you are also a Googler. You would have checked it out. You already know after this discussion that this headache can be because of tuberculoma, this headache can be because of brain tumor. Can I have it? How do I clarify? Only answer is neuroimaging and MRI. And be happy if it comes out normal. Don't feel uncomfortable. Are paise kharab ho gaye, waste ho gaye. No. Having a normal report is a blessing. You must thank that doctor. You have clarified. Probably you have a migraine headache which is always worsened because of high blood pressure, because of your stress levels. So when you have done once MRI, you know there is no stress. Kuch bhi ho, mere ko tuberculoma nahi hai, and brain tumor is not there. So you have clarified your doubt. Yes, technology is there. You must use it.
Yes, doctor. Raj Bharat पूछते हैं, my headache doesn't go away for 3 or 4 days. Many times it is mild, limited to forehead, one side, but the pain is very heavy in the front head to the neck. Kindly guide. And also to add to Raj Bharat's question, there's a question here that Anmol Kameshwari has been asking, that she's been taking medication Zerodol, which used to help her earlier, but now it's not helping her in managing her headaches. So these headaches, which I understand that these are longer duration headaches, what kind of medications will work, and will medication stop working after a point of time?
Yes, very good question and a very to the point short answers is 3 to 4 days headaches. I still believe there are less. There are chronic duration headaches. There are chronic headaches where people get it for any headache. We call it as a chronic headache. If they're more than 15 days in a month, there are a lot of patients who suffer from this. So if you have a 3 to 4 days, I'm not saying that's a blessing, but I'm saying it's lesser than what we see it otherwise. And yes, you need to address it. um, I would want to quote, I like to give philosophy which is meaningful. सब्र करना सीख लो, बर्दाश्त करना सीख लो, otherwise नजरअंदाज करना सीख लो. Make sure you have taken a professional advice. Make sure you have taken a professional advice. You have done a neuroimaging, and if you have both the things are done, 3 to 4 days, what usually happens is it's a gifted time for you to be yourself. Definitely at this time, I would ask you to go for a Botox therapy or Ironumab that usually helps for the refractory migraine headaches. And yes, the thing which usually helped out initially may not help you out on the later on time because you become refractory to it. Reaching out for professional advice and to a neurologist will help you out in such kind of cases. So there are a small percentage which you would need to address. Meditation and medication, these two things are very very important. What we end up doing it is we always overdo one part of it. Please balance it out. You have to have your own quiet time, you have to have your own BP sugar which is controlled, and regular medication that will help you out. I hope that clarifies your doubt.
Yes, doctor. Now that we've headed into monsoons, somebody was asking about sinusitis now. So there are triggers, seasonal triggers as well. अभी monsoon में क्या precautions लेने पड़ते हैं, and then coming up is winter. What are the precautions? These are the highest trigger points for headaches, right, doctor?
Yeah, say what we need to understand it is number one, when you say is about the seasonal thing, cluster headaches is of a
Yes.
seasonal thing. They only come in one particular area in the occipital region is what we say. And when we have such kind of cluster headaches, we take the treatment sumatriptan, or even for that matter verapamil also helps out, which is a cardiology antihypertensive drug. So first I will finish here only is one patient also comes back and asks, sir, verapamil, this is for heart, and why you are giving us, which is a very good drug to prevent of future headaches. Do not teach your doctor. It's always nice to clarify your doubts. I do not question that. So these are the seasonal thing where you get episodic headaches, which comes every season. Now coming to the season of a monsoon, which you have asked, yeah, during a particular monsoon time, we have sinusitis which increases, which usually happen because of non-clearance of secretion. Say we have sinuses here. These are the sinuses. We have a ethmoid sinus, maxillary sinus. When they get clogged, they are not able to come out. Then the fluid gets collected. Whenever fluid gets collected in the sinuses, it gets infected, and you get sinusitis. You need an antibiotic, a short course. You need a painkiller, a short course, and you will be fine over the day. When you have a headache, anytime the rest helps. Do not try to pull on yourself. Anytime the rehydration helps. Whenever you are taking a simple medicine for a headache is a paracetamol. One tablet will take
Okay.
care of paracetamol. It will take care of a majority of your of your pains. But paracetamol itself will cause you to lose water because you will be having a dehydration. So in that case, you have to make sure that you hydrate yourself well. And same thing is needed if you have an infection. So rest and rehydration is must. Professional advice is the best. So if these three things are taken care of, season will be something where you will enjoy a particular season, and monsoon is the best season for all of us to enjoy. Just enjoy, sit at home. Make sure instead of ordering pakoda and tea to your wife, you make it by yourself so that she also enjoys more than anybody else.
Yes, both of them are stress free. Yes, great. So, next question that I want to ask is well, never give it up. I'm getting headache before periods, doctor. I'm on medication for epilepsy and hypertension for 4 years. So,
A very great connection which she has put it. I'm very happy. Such kind of patients we all want it, because see, if we get a good history, it's easier for us to connect it and to help you out. So yes, migraine, there are few patients who get it during the periods. It's very well connected. She's already on the medication for the seizures, or seizure disorder and hypertension.
hypertension.
Any mismatch of that. So probably she has got a headache which is because of the high blood pressure, and she will take it, it's because of migraine. So balancing it out well. You can have headache because of high blood pressure. You can have headache even because of the bad eyesight. I'm carrying my glasses in front of me. I would want, if you have a doubt, always reach out for the, if you are 40 years of above, definitely once in a year ophthalmic consultation is important. Even if you're younger, you can be a child of 6 to 7 years or 10 years, and you cannot see properly and you have watering of the eyes, or your teacher is telling that child is not performing well. These things are the indicators that the child requires a ophthalmic consultation. So these are the specific points to address. For the lady who asked me about the headache with hypertension, make sure your blood pressure is controlled. If your headache, you are on anti seizure medicines, there are few medicines which increased your intracranial pressure. Okay, so there are medicines what you're already taking, could be the reasons. Like even we give nalidixic acid, we take steroids causes pseudo too much cerebri, which will increase the intracranial pressure, and these all things need to be addressed by the specialist, your doctor. Reach out to him, let him help you out. Last point, whenever you are going to a doctor, do take your previous prescription, do carry your medicines and show it to him if he asks. Lot of patients come to me, sir, this is a treatment which I'm taking, but they do not bring the medicines, and later on we have found out that they got the right prescription, but they are taking the wrong treatment because chemist has changed it and they never got to know
Ah,
it. Please
okay.
bring your prescriptions, all investigations done in past, and all the medicines which you are using it. This is very important,
Great.
especially for the lady who took the question. Yeah.
All right, doctor. So, with that, I'll have to close today's session. So, before we leave, I would want you to give us some top tips to understanding our headaches and managing them.
Best way to manage a headache is हंसते रहिए, खिलखिलाते रहिए. ये जिंदगी एक इस रीजन के लिए है कि आपके आसपास लोग खुश रहें, तरक्की करें. अगर इन सब के बीच में कभी भी हेडेक आए, तो ब्लड प्रेशर चेक करके ऑफ्थेल्मिक डॉक्टर को दिखाने के बाद एक प्रोफेशनल एडवाइस फिजिशियन से लीजिए, न्यूरोलॉजिस्ट से लीजिए. बॉस, बीवी और वैद्य, BBB, एंड डेफिनेटली बच्चे. नाउ आई एम गिविंग द 4 नेम्स: बॉस, बीवी, वैद्य एंड बच्चे. इनको खुश रखिए और इनकी सलाह मानिए. आप जिंदगी भर डॉक्टर से दूर रहेंगे, और उसके लिए आई एम ऑलवेज अवेलेबल फॉर यू. Any doubt you have any time, feel free to reach out to me at 810-612-7475. If you are our client from Apollo 247, a WhatsApp advice is available free of cost once or twice. Please don't call me. I may not be able to take the question during the call, but I will always help you out with message sometime within 24 hours. With these words, over to Jhansi, who's helped me out with this wonderful discussion. And reach out to us before it is too late. May God bless you all. Thanks for watching us. Namaskar.
Wonderful session with you, doctor, because people are also thanking you on on YouTube. Thank you so much for being with us on a Sunday morning. We appreciate your time and energy. Thank you, doctor.
Thank you, ma'am. Take
So
care.
that is
Namaskar.
Dr. Yes, that's Dr. Ashish. So we now continue with our health quiz. Now I'm going to ask you 3 questions. You have to answer only on the YouTube chat. Winner's name will be announced at the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. Winners, once you have I have announced your name, please contact with your details at marketing@apollo247.com. Gift vouchers will be shared with you. Here are today's questions. Question number 1 for today is, what is the full form of CT scan? CT scan का full form क्या है? Question number 2, who would you consult for a migraine? अगर आपको migraine है, आप किसको consult करेंगे? Question number 3, what is this circle cashback called? Apollo 24/7 app download कीजिए, then you will understand circle membership. What is the circle cashback called? Go ahead and type your answers in the YouTube chat. I'm waiting for your answers. In the meanwhile, let me also give you coupons, gift coupons, which you can use on Apollo 24/7. आप डॉक्टर कंसल्टेशंस कर सकते हैं डायरेक्ट फ्रॉम अपोलो with flat 150 rupees off on the first online doctor consultation. Use the code FIRSTVC. The code that you can use is FIRSTVC, and you have to download Apollo 24/7 app to avail these coupons. And the next code that we are giving you off is code FIRST3. You order medicines direct from Apollo and flat 25% off मिलता है आपको online medicine orders पे. Download Apollo 24/7 and use the code FIRST3. Well, here's a coupon which is exclusively for Apollo 24/7's Health Hour viewers. Thank you, viewers, for joining us on this Sunday morning and asking your questions. So this is an exclusive coupon that you can use. It is HH247. And you know what you get? You get up to 199 rupees off on online consultation with Apollo doctors and up to 20% off on medicine orders as well. And this is in addition to the other coupons that you have I've announced before. Well, it was a great session today. It was very, very informative and very, very active session where a lot of people have asked their questions, and I hope we have tried to, paucity of time, we could not answer many questions. But thank you all for joining us today. Next week, we are bringing you a very, very important session, Secrets to Good Sleep, because we know that good sleep is a road to good health. We are bringing you a very, very important session, Secrets to Good Sleep. Join us next Sunday, that is 17th July at 11 a.m. in this live session, where you can ask your questions about sleep disorders or any other issues which are related to sleep. We shall get answers for you. And if you do not want to miss any of these sessions, go ahead and subscribe Apollo 24/7 YouTube channel, and also there's a bell icon which you can turn on and get notifications as well. Also, we can be followed on the social handles. All the social handles and the other links are given below in the YouTube description box, which you can use. And here are the winners for today. The winners are Harminder Kaur, Joel Raj Sorna, and Sandeep Kaur. Congratulations. You have to write back to us with your contact details to marketing@apollo247.com to claim your prizes. Thank you all of you for joining us today in this week's session. We thank Dr. Ashish Chauhan as well. And next week we shall see you. Thank you once again.